Here's HealthWise with Karin McCay.
When we think of cancer, we usually think of lung cancer, breast cancer, colon cancer, but abdominal cancer can include so much more than the organs inside the belly. The good news is a new doctor in Lubbock has brought with him a new procedure that gives patients with a difficult cancer a fighting chance for a cure. When you see this, you know what's going to happen.
A big bubble of gum, and then they would pop it and it would just...
Dr. Tyler Mao says what the bubble leaves behind is a good way to explain.
You have a membrane like that on the inside of your abdomen that's coating everything with a thin layer.
That thin layer is called the peritoneum, and peritoneal cancer is rare, but it usually starts with something more familiar.
Cancer of the stomach, colon cancer, appendiceal cancers, all of these can lead to this.
Dr. Mao is the first surgeon in Lubbock to offer something new to fight peritoneal cancer. It's called the HIPEC procedure.
So it stands for hyperthermic intraperitoneal chemotherapy.
This is it, and it doesn't look like a mighty cancer fighter, but the power is in this box, which heats the chemotherapy.
We put a mat on the bed that allows us to cool the patient so that even though we're putting a hot fluid into them, we're keeping their temperature at a normal range.
It's not an easy surgery. The heated chemo alone is reason enough for the patient to be asleep. But Dr. Mao says studies have shown that when you heat chemotherapy, it becomes even stronger medicine.
First, we do the operation where we take out all visible tumor. Then we heat up the chemotherapy. The idea is after you've had your surgery, we're using that to clean up any tumor cells that might be floating around.
Floating in a lining that is so thin, it's difficult for normal chemotherapy to reach.
It's neat to be on the cutting edge of technology. This is new to our area, and since we're the only ones in the region doing this procedure.
The procedure leaves a pretty long scar down the belly, but for many with ovarian or colorectal or appendiceal cancer, a scar is a small price to pay.
There are some patients that go on to live long, otherwise normal lives, and there are plenty of patients that are actually cured by this.
As with any surgery, of course, there are risks, and patients need to be monitored while hearing, and that's why it's healing. And that's why it's important that the HIPEC procedure is offered in Lubbock now at UMC, where people can stay here for their healing rather than go to Dallas or Houston for the procedure and the recovery.